Hello everyone. Today I would like to speak on a topic called stroke. Stroke is nothing but a sudden paralysis due to a vascular insult. That means either a bleeding into the brain or blockage of a vessel into the which supplies the brain. There are two major arteries which supply the brain. One is called the carotid artery. The other artery is called the vertebral or basilar artery. So this supplies the front part of the brain as well as the back part of the brain, including the cerebellum, the brainstem, the spinal cord. So basically this occurs within seconds to minutes. It's called an acute vascular insult. Okay, so how do you know that is a stroke? Because there is a great slogan called time is brain. With each loss of minutes to hours, you are losing millions of neurons in your brain. So it is of utmost importance that you should try to minimize the time required for early treatment. So you should know that this particular slogan, FAST, F-A-S-T. F means sudden facial droop. Suddenly when you are speaking, the face droops to one side, the right side or left side. Or suddenly when you speak, the hand drops down. Or you are not able to walk because of the weakness of a limb, either right side or on left side. And similarly, you won't be able to get the words. Suddenly you are stuck like this. Or if you tell me something, I wouldn't be able to understand you. That means you feel like you are speaking some other language. So the patient won't be able to understand or won't be able to speak out and won't be able to repeat or read, write, calculate, many things. So it's only a tip of the iceberg, because brain is the head control for everything, whether for your thoughts, your speech, your memory, your emotions, your smell, taste, hearing, movement, balance. Everything is dependent on this part of the brain. The brain controls through the various nerves. Okay, it supplies multiple cranial nerves, 12 cranial nerves and 31 pairs of spinal nerves. But the major control is in the motor area, the motor cortex of the brain, either on the right side or on the left side. Suddenly, if the artery supplies that part of the brain is blocked, you get sudden weakness, either right side or left side. If that part of the artery is blocked, we supply this part called the occipital lobe, the vision area. Suddenly you lose vision. You won't be able to see anything. Maybe one side or both sides. So similarly, there are so many vessels, so many areas of the brain which supply your speech area, your praxis, that the way how you are going to do something, how I can understand you, how I can appreciate your face, or many things. I'm just telling a few examples because there are so many areas of the brain. Each one has got its own specific functions. All right. So basically the symptoms are weakness, facial weakness, limb weakness, unsteadiness, memory impairment, speech impairment, or inability to sense the surroundings, something called a visuospatial disorientation. Okay. So what are the various risk factors to produce stroke? Basically, there are two types of risk factors. One is called non-modifiable risk factor. The non-modifiable risk factors are your age. You can't do anything about your age. Similarly, your gender, either you are a male or a female or a neutral thing. So you can't do anything about that because it's already set. Thirdly, your race or your ethnicity. It's all you are Asian. You can't say that you are a European or American because your race is also set. So these are things which you can't do anything. But there are lots of things which you can modify, you can change. Your hypertension, if there are hypertension, you can treat. Diabetes mellitus, you can treat with either a lifestyle, exercise, drugs or insulin. High cholesterol, you can treat the high cholesterol by diet, exercise or medications. Okay, so similarly there are conditions like many problems related to the heart, the rhythm disturbance, atrial fibrillation, any clot formation in the heart attack, myocardial infarction, muscle damage, or any valvular disease which would lead to more clot formation. There are many conditions where there can be clots form the heart, and this can get dislodged to different parts of the body, including the brain. If it goes to brain, this causes stroke, or if it goes to the limb, this causes loss of blood supply, and this might lead to amputation or removal or cutting off the particular limb. So there are many. So then smoking, the so-called smoking habits, this also compounds the chance of getting a stroke. Alcohol intake, because alcohol is a J-shaped curve. That means if you take alcohol in low quantity, this is good for your heart, your brain, everything. But naturally, what happens? Alcohol is not a it's a drug, because what happens? This gets a tolerance. If you take one peg, maybe you are feeling okay, but after some time, this one peg is not enough to give you any pleasure at all. So now normally you would take a 2 pegs, 3, 4, like that. In that case, this goes up, the risk goes up. So it's called a J-shaped curve. That's the reason alcohol is not good for your brain, your heart, or liver, or kidneys. So, or any other recreational abuse of various drugs like amphetamine, heroin, many things, chewing tobacco or other tobacco products. So all these things you can remove either by you can reduce it, you can stop it, you can your lifestyle. You can reduce your weight. You have to do at least 4 to 5 days of regular exercise. You should walk at least 40 minutes per 5 days per week, or do some other exercise maybe every at least 5 days per week, at least 40 to 50 minutes. This is good enough. So similarly, if your blood pressure is high, suppose that you reduce your blood pressure, your systolic blood pressure by 10 or the diastolic blood pressure by 5, this would lead to result in a 38 to 40% reduction in the risk of stroke. Similarly, if you control your blood sugar, this is 3 times the chance of getting stroke is reduced. That means if there is diabetes, this is a 3 to 4 times chance of getting a stroke. In the same way, the diabetes, all the risk factors. Some people don't take non-vegetarian food, including milk. They are prone for a condition called hyperhomocysteemia. This would result in accelerated atherosclerosis. The heart gets blocked, the brain gets blocked, get dementia and other various features due to low vitamin B12. Because vitamin B12 is found only in the non-vegetarian source. You can have it from milk or milk products, egg or fish, meat or other meat products. So if this is deficient, this can also result in accelerated atherosclerosis, early myocardial infarction or stroke or other various complications. So once these are the various risk factors, the non-modifiable or modifiable risk factors. So if the patient gets any symptom like weakness, ataxia or unsteadiness or facial droop or difficulty to speak, immediately you should go to the hospital and get evaluated. Don't waste any time thinking that this due to your low sugar or you didn't get sleep or you are tired and tense like that. Immediately get a CT scan done. CT scan is the best one because that saves time, because MR takes a longer time. MR is required only if you don't know, because especially you wake up stroke. You get up in the morning and find that you have a weakness. But you don't know when this happened, the morning or during the late evening. In those cases, MR is the ideal modality of choice for neuroimaging. Otherwise, CT scan and CT angiogram, then you know that there is a occlusion or a blockage of a particular vessel, either carotid artery, mediastinal artery, vertebral artery, basilar artery. Any of these vessels can get blocked and give rise to a stroke. So if it's up to 4.5 hours, we give a one drug called actylase or tenectase within 4.5 hours. And if there is a blockage of the artery, it's better to take out the clot or the thrombus through a device called a mechanical aspiration, mechanical thrombectomy. Basically by 2 means. One is by a stent called a Trevo stent or Salter stent, preset. Many stents are available. This would engulf the clot, and you can remove the clot as a hole into the catheter and can remove the catheter out. Or you can aspirate by a system called a penumbra aspiration system. You put the aspiration catheter just proximal to the clot and by a negative pressure, by a vacuum, you remove the clot. As simple as that. But the problem is that you should do that as earliest. Don't wait for 8 hours, 12 hours or 36 hours. There are people who can be salvaged, can be saved even up to 24 hours, but those are very few in number, especially those whose collaterals or the brain is getting perfused by different vessels. Sometimes those people, they can have a longer time window. Maybe you can do up to 24 hours. I've done a case up to 31 hours, but those are rare. So if the patient comes at earliest, within 4.5 hours, give the IV treatment as well as look for any clot in the vessels. In that case, you can remove that. Beyond 4.5 hours, we would also use some other model called CT per perfusion or MR per perfusion, where you know that whether the brain can be salvaged. If there are more than 50% of the brain is okay, that means can be saved, then you can go ahead and do a thrombectomy even after 4.5 hours, 6 hours, 10 hours, up to 24 hours. Beyond 24 hours, very, very rarely, especially in vertebrobasilar stroke, there are case reports. If you review the literature, you could see that it is possible. But those things are extremely rare. So, my request is that if any one of you or your relatives, your friends get a stroke, don't waste and don't wait. Immediately take them to a nearby hospital and get it done, like a CT or MRI, and see whether any salvageable brain or the brain can be saved immediately. So, it can be either by IV injection or by removal of the clot or both. Sometimes we may have to do both, followed by care in a ICU care, a stroke unit, and rehabilitation and continuation of the medications lifelong. Okay, so it's always better to prevent stroke rather than getting it and treating it. So the basic thing is you remove all the risk factors, be healthy and take a good nutritious diet, change your lifestyles. You remove your avoid your smoking, be sober, don't drink alcohol, don't abuse any drugs or heroins or something like that. Control your blood pressure to 120/80, keep your blood sugar to 120, and your cholesterol also LDL around 70, your body mass index between 20 and 25, and have a good stress-free life and sleep adequately and remove unnecessary stress. Thank you. Thank you very much. Bye.